Hi friends, welcome to my channel Nursing Guru 24. Today we are going to discuss about some frequently asked questions in a nursing competitive exams related to normal newborn and preterm babies. Before proceeding with MCQs, we will see the characteristics of normal newborn. First, we will see physical characteristics. In that, weight. The normal Indian newborn baby's weight is typically between 2.5 to 3.5 kg. Length will be 45 to 55 cm. Head circumference 33 to 35 cm. It is slightly larger than chest circumference. Then chest circumference 30 to 33 cm measured at the nipple line. Skin will be pinkish in color, smooth and soft. May have vernix caseosa and lanigo. What is vernix caseosa? Vernix caseosa is the white creamy substance found on newborn baby's skin, and lanigo are the thin, fine, silky hairs. Next, fontanelles. Anterior fontanelle and posterior fontanelle. Anterior fontanelle is larger one comparing to posterior fontanelle and is diamond shaped and closes by 18 months or 1.5 years. Posterior fontanelle is triangular shaped. It closes by 6 to 8 weeks or 1.5 months. Next, umbilical cord. Umbilical cord is thick and gelatinous with 2 arteries and 1 vein. It dries and falls off within 7 to 10 days. Then reflexes, some primitive reflexes like Morose reflex, rooting reflex, sucking and grasp reflexes will be there. Next, babies born before 37 completed weeks of gestation are called as preterm babies, and babies born after 42 weeks of gestation are called as postterm babies. Second one, vital signs. The normal heart rate will be 120 to 160 beats per minute, may decrease during sleep. Respiratory rate 30 to 60 breaths per minute, and temperature, auxiliary temperature will be 36.5 degrees Celsius to 37.5 degrees Celsius, and blood pressure will be around 65 by 40 mm of Hg. That varies with weight and age. That posture, flexed arms and legs, spontaneous and symmetrical movements, loud and vigorous cry indicating good health, and good muscle tone with active resistance of passive extension. Fourth one, sensory development. In that, first one, eyes. Eyes can focus on objects 20 to 30 cm away, identify human faces and high contrast objects. Ears respond to loud sounds. Hearing is fully developed at birth. Taste, babies can identify sweet tastes. Touch, they are very sensitive to touch, especially on the lips and cheeks. Smell, they can recognize the mother's smell within a few days. Fifth one, feeding and elimination patterns. Feeding. Breastfed newborns feed every 2 to 3 hours. Formula fed newborns every 3 to 4 hours. Urination, at least 6 to 8 times a day after the first few days. Stool, meconium, thick black-green stool passed in the first 24 to 48 hours. Transitional stool, this is yellowish-green color appearing by day 3 to 4. Then normal stool is yellow or yellow-brown color. Next, immune system. Immunity receives maternal antibodies, that is IgG antibodies, through the placenta, providing passive immunity for the first 3 to 6 months. Other features include jaundice, that is physiological jaundice that may appear after 24 hours and resolve within 1 to 2 weeks. For in detail neonatal jaundice, watch my separate video on neonatal jaundice. Next, breathing pattern, irregular with periodic breathing pauses. Next, we will start with frequently asked MCQs on normal and preterm newborns in various competitive exams. The first question is, what is the normal birth weight of a full-term newborn? The options are 1.5 to 2.5 kg, 2.5 to 3.5 kg, 4 to 5 kg, and less than 1.5 kg. As I told, in normal characteristics, the average birth weight of an Indian full-term newborn is between 2.5 to 3.5 kg. Hence, the answer is B, that is 2.5 to 3.5 kg. Babies weighing less than 2.5 kg are LBW babies, low birth weight babies, and if they weigh less than 1.5 kg, they are called very low birth weight babies. Next question is, the first stool passed by a newborn is called. The options are colostrum, transitional stool, meconium, and vernix caseosa. First I told colostrum. What is colostrum? Colostrum is the milk produced during the first few days after birth. It is usually yellow or orange in color. Then what is transitional stool? Transitional stool is yellowish green stool that starts when baby starts to digest the breast milk. It is the phase of stool when the baby's bowel movements are started. Then what is meconium? Meconium is a newborn's first stool. Meconium is a dark green, thick and sticky substance. And what is vernix caseosa? Vernix caseosa is a white, creamy substance that is found on the skin of a baby. Hence, the answer for this question is meconium. Meconium is the first stool passed by the newborn after birth. Next question is, what is the ideal room temperature for a preterm baby? The options are 16 to 18 degrees Celsius, 20 to 22 degrees Celsius, 25 to 28 degrees Celsius, and 30 to 32 degrees Celsius. The answer for this question is 25 to 28 degrees Celsius. 16 to 18 degrees Celsius or 20 to 22 degrees Celsius of room temperature may cause hypothermia. 30 to 32 degrees Celsius may cause hyperthermia. For hypothermia and hyperthermia and thermoregulation in newborns, I made a separate video. You can watch that video. Next question. Which of the following is a common complication in preterm newborns? Options are hypoglycemia, polycythemia, hypertension, hyperbilirubinemia. First we will see how hypoglycemia causes some complications. Preterm babies are more likely to develop hypoglycemia because they have lower glycogen and fat stores and their metabolic demands are higher than full-term babies. Then what is polycythemia? Polycythemia is a condition in newborns where there are abnormally high levels of RBCs in their blood. Polycythemia is caused by delayed clamping of the umbilical cord, diabetes in the mother, etc. Then how hypertension? Congenital conditions like aortic coarctation, PDA, patent ductus arteriosus, and renal artery stenosis are examples of congenital conditions that can cause hypertension. Then some certain medications also like dexamethasone, theophylline, ophthalmic drops can cause hypertension in newborns. Hence, the answer for this condition is this question is hypoglycemia. Next question. The best method to maintain body temperature in a preterm baby is? Options are radiant warmer, incubator, kangaroo mother care, swaddling. First we will see the meaning of these options. First one, radiant warmer. What is radiant warmer? A radiant warmer is an open bed with a heating element positioned above it. The heating element emits infrared radiation to provide warmth directly to the infant. The purpose of the warmer is to maintain the infant's body temperature while providing easy access for medical interventions or routine care. Usually, warmers are used immediately after birth in delivery rooms or NICUs. Then what are incubators? Incubators are used for high-risk preterm neonates. An incubator is a closed temperature controlled chamber designed to create a stable environment for the infant. The purpose of the incubator is to provide consistent warmth and humidity to keep the baby maintain body temperature. And incubators protect the newborn from external environmental factors like noise, light, and some potential infections. Incubators are usually ideal for long-term care of preterm or critically ill infants. Then what is kangaroo mother care? Kangaroo mother care is a natural method of caring for premature or low birth weight infants that involves skin to skin contact. Then what is swaddling? Swaddling is a technique that involves wrapping of the baby in light clothes to help them sleep better by restricting the movements. Hence, the answer for this question is kangaroo mother care. Next question. The Apgar score evaluates all of the following except. The Apgar score evaluates all of the following except the options are appearance, pulse, gestational age, activity. The answer for this question is gestational age because gestational age is not included in Apgar scoring. Apgar stands for appearance, pulse, grimace, activity and respiration. For Apgar scoring, I made separate video. You can go through that video for more details. Next question is, what is the most common cause of respiratory distress in preterm infants? Options are meconium aspiration syndrome, bronchopulmonary dysplasia, respiratory distress syndrome, persistent pulmonary hypertension. We will see the meaning of these alternatives or options. First one, meconium aspiration syndrome. What is meconium aspiration syndrome or MAS? MAS is a condition that occurs when a newborn breathes in a mixture of meconium and amniotic fluid into their lungs. Meconium aspiration syndrome is a condition in which newborn babies breathes mixture of meconium and amniotic fluid into their lungs. Then what happens when it is or when newborn babies are breathes, meconium affects normal breathing by blocking the airways and thereby it obstructs the respiration. It is more common in post-term babies. Then what is bronchopulmonary dysplasia? Bronchopulmonary dysplasia is a chronic lung disease that affects premature infants or newborns. It occurs when the lungs and airways of a newborn are damaged, causing the air sacs in the lungs to become destroyed. This is uncommon than other RDS and MAS, means respiratory distress syndromes and meconium aspiration syndrome. Then what is respiratory distress syndrome? Respiratory distress syndrome is a condition in which the lungs cannot provide sufficient oxygen to the body due to impaired lung function. Respiratory distress syndrome is a condition in which lungs cannot provide sufficient oxygen to the body due to impaired lung function. In newborns, RDS is caused by a lack of surfactant. What is surfactant? Surfactant is a substance that helps keep the air sacs or alveoli in the lungs open. Surfactant helps to keep the air sacs or alveoli in the lungs open. Without enough surfactant, the lungs may collapse, making it difficult to breathe. Without enough surfactant, the lungs may collapse and they may cause difficult breathing. Then the meaning of last option, that is persistent pulmonary hypertension. It is a serious condition that occurs when a baby's blood vessels to the lungs don't open fully after birth. In persistent pulmonary hypertension of the newborn, baby's blood vessels to the lungs don't open fully after birth. By above description, it is clear that the answer for this question is respiratory distress syndrome. Next question is, which is the preferred feeding method for a preterm newborn unable to suck? Which is the preferred feeding method for a preterm newborn unable to suck? Options are breastfeeding, spoon feeding, tube feeding, and cup feeding. Obviously, the answer for this question is tube feeding because breastfeeding, spoon feeding and cup feeding requires the baby to suck the breast? Here the answer is there in question itself only. Next question is, the normal respiratory rate for a newborn is 20 to 30 breaths per minute, 30 to 60 breaths per minute, 60 to 80 breaths per minute, 80 to 100 breaths per minute. As we discussed in characteristics of normal newborn, the answer for this question is 30 to 60 breaths per minute. Next question, which of the following conditions is prevented by administering vitamin K to newborns? Options are rickets, hemorrhagic disease of the newborn, iron deficiency anemia, neonatal jaundice. First we will see the meaning of these questions. What is rickets? Rickets is a bone disease that occurs due to a lack of vitamin D, calcium or phosphorus. Rickets is not hemorrhagic disease. It is bone disease that occurs due to lack of vitamin D, calcium or phosphorus that causes soft and weak bones in children. Then what is HDN or hemorrhagic disease of the newborn? Hemorrhagic disease of the newborns are bleeding disorders. Usually newborn babies have very small amounts of vitamin K stored in their bodies, which can lead to a serious bleeding problem known as vitamin K deficiency bleeding disorder. As we all know, vitamin K is coagulant, hence vitamin K is given to prevent hemorrhagic disease of the newborn. What is the dose? Dose is 1 mg per 0.5 ml or 1 mg per 1 ml. Hope you all know the site of injection, that is anterolateral aspect of the thigh. Then what is iron deficiency anemia? Iron deficiency anemia is a common type of anemia that occurs when the body doesn't have enough iron to produce hemoglobin. Then what is hemoglobin? Hemoglobin is a substance in RBCs that carries oxygen. Then fourth option is neonatal jaundice. Neonatal jaundice is the yellowish discoloration of skin that occurs due to increased levels of bilirubin. For neonatal jaundice, I made a separate video. For more details, you can watch that video. Obviously, from above description, it is clear that the answer for this question is hemorrhagic disease of the newborn. Vitamin K is used to prevent the HDN. Next question is, what is the most reliable method to monitor fluid balance in preterm infants? What is the most reliable method to monitor fluid balance in preterm infants? Options are measuring urine output, weighing the baby daily, checking the blood pressure, observing for dehydration signs. The answer for this question is weighing the baby daily. We will see how. Weighing the baby daily for at least 7 days gives accurate monitoring of changes in fluid status, because preterm infants have a high proportion of total body water and are very sensitive to fluid shifts. A sudden weight gain or loss can indicate fluid retention or dehydration. Hence, this is the most reliable indicator comparing to other options. Then measuring urine output. Measuring urine output is also useful, but it may not show the full picture of fluid balance. It only shows renal output and does not assess for insensible losses or other fluid shifts. Then checking the blood pressure. Blood pressure can indicate circulatory status, but it is not a reliable indicator of overall fluid balance. Fourth one, observing for dehydration signs. Clinical signs such as sunken fontanelles or dry mucous membrane can indicate dehydration, but are subjective and less reliable in preterm infants. Hence, weighing the baby for at least 7 days is a reliable indicator, and this is the answer for this question. Next question. The normal gestational age of a term newborn is 28 to 32 weeks, 33 to 36 weeks, 37 to 42 weeks, more than 42 weeks. First we will see what is gestational age. Gestational age is the period of time between conception and birth. Gestational age is the period of time between conception and birth. How it is measured? It is measured in weeks from the first day of the last menstrual cycle to the current date. It is measured from the first day of the last menstrual cycle to the current date. A normal pregnancy can range from 37 to 42 weeks. The babies born before 37 weeks of gestation are called as preterm babies. Babies born after 42 weeks of gestation are called as postterm babies. Here the answer for this question is 37 to 42 weeks. Next question is, what is the gold standard for monitoring oxygenation in preterm newborns? Options are pulse oximetry, arterial blood gas analysis, capillary refill time, chest x-ray. We will see how. The answer for this question is ABG analysis, arterial blood gas analysis. ABG analysis provides accurate and detailed information about the levels of oxygen, carbon dioxide and blood pH, which are important for assessing and managing respiratory and metabolic status in preterm newborns. It is considered the gold standard due to its accuracy. Other three methods are not so much accurate. Pulse oximetry. Pulse oximetry is non-invasive and commonly used for continuous monitoring of oxygen saturation. It is less accurate because it cannot measure carbon dioxide levels or pH. Then capillary refill time. This is a simple bedside assessment of perfusion and circulation. It doesn't measure oxygenation. Then chest x-ray. Chest x-ray is useful for diagnosing structural lung issues or complications like pneumothorax, but it doesn't directly measure oxygenation. Hence, answer for this question is arterial blood gas analysis. Next question is, hypothermia in preterm newborns is defined as a body temperature below. Hypothermia in preterm newborns is defined as a body temperature below. Options are 36.5 degrees Celsius, 35 degrees Celsius, 37 degrees Celsius, 36 degrees Celsius. The answer for this question is 36.5 degrees Celsius. What is hypothermia? Hypothermia is a condition in which a newborn's body temperature drops below 36.5 degrees Celsius or 97.7 degree Fahrenheit. If the body temperature falls below 36.5 degrees Celsius, then that is called as hypothermia. For more details, you can watch my video in my channel named Thermoregulation in Newborns. Next question. Which is the best way to assess hydration status in a newborn? Options are skin elasticity, urine output, capillary refill time, heart rate. Answer for this question is urine output. We will see how. Urine output is a reliable indicator of hydration status in newborns. Normal urine output in neonates is typically 1 to 2 ml per kg per hour. Reduced urine output suggests dehydration. Excessive output may indicate fluid overload or other issues. Skin elasticity. Skin elasticity or skin turgor may not always reliable in newborns because of less subcutaneous fat. Next, CRT or capillary refill time. This can indicate perfusion and circulatory status, but CRT is not used for assessing hydration. Heart rate. Changes in heart rate can occur with dehydration, but other factors also influence rate of heart rate. Hence, it is a less specific indicator. Hence, considering all these, urine output is best way to assess the hydration status. Next question. What is the normal heart rate for a newborn at rest? This already we discussed. The options are 80 to 120 beats per minute, 100 to 140 beats per minute, 120 to 160 beats per minute, 160 to 200 beats per minute. Obviously, the answer is 120 to 160 beats per minute. Next question. Preterm babies are more prone to hypoglycemia because of options are low glycogen stores, high insulin levels, poor feeding ability, all of the above. We will see the description of these options. Preterm babies are more prone to hypoglycemia due to several factors. First option, low glycogen stores I told. Preterm infants are born without collecting sufficient glycogen in the liver. We all know glycogen is responsible for maintaining blood glucose levels during fasting. Hence, lack of sufficient glycogen may cause hypoglycemia. Second, I told high insulin levels. Preterm infants may have immature glucose regulation that leads to hyperinsulinemia that can lower the blood glucose levels. Next, poor feeding ability. Preterm babies sometimes have difficulty with sucking, swallowing, and coordinating feeding, which reduces their ability to take insufficient calories. Combination of all these factors makes preterm infants more vulnerable for hypoglycemia. Hence, the answer for this question is all of the above. Next question is, which immunization is given to all newborns immediately after birth? Options are BCG, hepatitis B, OPV, both BCG and hepatitis B. BCG given to prevent tuberculosis. It is often administered shortly after birth but not necessarily immediately. Hepatitis B vaccine is typically given to all the newborns immediately after birth as a part of the universal immunization schedule to protect against hepatitis B infection. OPV, oral polio vaccine, sometimes given at birth in endemic areas, but its timing depends on regional immunization policies. Both BCG and hepatitis B, both vaccines may be administered in the neonatal period. It is recommended to give immediately after birth. Hence, the option for this question is both BCG and hepatitis B. Next question is, the most common cause of neonatal sepsis is, options are Staphylococcus aureus, Escherichia coli, Group B Streptococcus, Klebsiella pneumonia. Group B Streptococcus is the most common cause of early onset neonatal sepsis. It is usually transmitted from the mother to the baby during labor and delivery. Staphylococcus aureus is more commonly associated with late onset sepsis and hospital acquired infections. Escherichia coli is common cause of neonatal sepsis, particularly in preterm infants due to maternal infections, but it is less frequent than Group B Streptococcus in early onset sepsis. Klebsiella pneumoniae is associated with hospital acquired infections in neonatal intensive care units. Hence, the answer for this question is Group B Streptococcus. Next question is, a preterm newborn is classified as a baby born before. A preterm newborn is classified as a baby born before. This already we discussed. Options are 30 weeks of gestation, 32 weeks of gestation, 37 weeks of gestation, 34 weeks of gestation. The answer for this question is 37 weeks of gestation. Babies born before 37 completed weeks of gestation are called preterm babies. Babies born before 28 weeks are called as extremely preterm babies. Babies born between 28 to 32 weeks are called as very preterm babies. Hence, answer for this question is 37 weeks of gestation. These are the frequently asked MCQs in nursing competitive exams. If you like this video, please do subscribe, share and like the video. Thank you.